So moving on to the next topic that we're going to talk about today, which is researchers looked at who died at higher rates of overdose deaths between men and women using data from 2020 to 2021. And this article or paper was written in the Neuropsychopharmacology Journal, which is quite a mouthful of a name for a journal, but shout out to them for that. So some context on this. So as we all know, opioids have been surging for the last maybe decade plus now. And one of the things that I think about a lot is because I did a lot of opioid work while I was in my Master's of Public Health program, that the opioid crisis has still been going on while the pandemic has been going on, and it has gotten a lot less attention. And I think that it's an important topic to think about. We really do need the structures and systems in place to really take on opioids, but I will dig deeper into that at some other point in time in life, because I think that that's an important conversation to have. So in this study, they researched overdose deaths of men versus women across the lifespan. They used state-level analysis of epidemiological data on overdose mortality. So they looked at synthetic opioids, heroin, stimulant drugs such as methamphetamine and cocaine. The drugs were analyzed independently because they have different toxicity pathways. I think the article digs in a little deeper about that, but that's above my epidemiology pay grade. And I know you might be asking yourself as well, was the data controlled for other things? And yes, it was. So the researchers accounted for, or AKA controlled, for all things that you were thinking of. So men using drugs at higher rates than women, men's propensity to develop substance use disorders higher than women, and the level of misuse between men and women. And after looking at all this data, they still realize that men were and are dying from overdoses at higher rates than women in the US. The paper concluded that men are dying from overdoses at 2 to 3 times greater rates than women in the US between the years of 2020 and 2021. So this isn't the actual article. This is the NIH news release on the article, and we'll share both of these articles down below. The NIH is a summary of the larger article, and I'll share a little piece of the larger article just now. So we're going to be looking at the rates at which these drugs have killed women versus men. All the rates are going to be per 100,000 people or 100,000 of the population. And just to reiterate what they were saying, as I have highlighted here, for specific drugs and after controlling for sex-specific rate of drug misuse, the researchers found that the overall rates of drug overdose deaths by sex from 2020 to 2021 for synthetic opioids, example fentanyl, was 29 deaths for men compared to 11.1 for women. When they looked at heroin, it was 5.5 for men compared to 2.0 for women. When they looked at psychostimulants, example methamphetamines, it was 13.0 deaths per men compared to 5.6 for women. And when they looked at cocaine, 10.6 deaths for men compared to 4.2 for women. So I think this is really highlighting that there is some sort of disparity in what is happening, and it is something that we have to think about when we are thinking about public health interventions and policies that need to be enacted to prevent these types of issues. So the authors hypothesized that the combination of biological, behavioral, and other social and gender-related factors were the cause behind men dying at higher rates of overdoses than women. So when you think about biological, you think about something like men having a greater vulnerability to the toxicity of drugs than women, which is interesting in itself. And I feel like that you could dig into a lot more research around that. When they looked at the behavioral, so thinking about things like men may use these drugs in a riskier way than women, as well as social context, when we think about social determinants of health, as well as gender-related factors. And they went on in the article to talk about specific genes, and once again, a little bit above my pay grade. So why does this matter? As you all know, we are all health equitists listening to this, or public health professionals, and public health professionals here. And a lot of the heart of this work that we do is understanding the issues and creating avenues to prevent and protect populations. And when I say that, I mean enacting policies, structures, and programs to ensure that we are addressing health outcomes equitably and making sure that it's equitably. And that's why we have to think about data when we are doing a lot of these practices. And I think being able to tailor the right solution to the right community and understanding that we have to look at issues in multi-layered ways, considering the biological, behavioral, gender, and often most important social factors are very, very cool. One thing that I wanted to highlight from the actual article, which I will pull up here in 1 second. So the thing that I wanted to mention here and what they noted in the paper around the limitation section was that, and quote, finally, the coding of gender identity in national mortality data is not currently routine, and these data sets do not provide information specifically for transgender or non-binary persons. This is an important issue because of the risk of SUDs or substance use disorder and overdose in transgender, non-binary, and or gender expansive communities. And I think this is a really good point that the authors mentioned, that even though we are looking at this data from a men versus women perspective, we're leaving out other communities because in this data, this national mortality data set, it does not ask the question about gender. And once again, we really need to think about how are we looking at data, how are we getting data so that we can enact the policies, the structures, and the programs to really address the needs of the community in the most equitable way. So highlighting my thoughts, this is very fascinating, and I think there's a lot more work that is going to be done to better understand this, whether that is understanding more of the biological, behavioral, gender, or social factors, and just understanding like why is this the case, and how can we set up ways to prevent and protect populations around this. So a lot more to see here, but I just thought it was a really cool article that I want to highlight. And yeah.
Yeah, and it's really timely because if anyone knows me, you know that I watch a lot of television. So there's the new I guess, is it a documentary? No, because it's fictionalized. But it's they do draw from a lot of the truth around the OxyContin scandal and the Dr. Richard Sackler and Arthur Sackler, who like that family that essentially is responsible for the OxyContin use. And it's called Painkillers. It's on Netflix. Really good documentary. I watched it this weekend. Sorry, not documentary. It's dramatized. But the one thing that they did show was how insidious the opioid pandemic epidemic is, and kind of how it started from the doctors and the drug pharmacists and from the reps that were kind of pushing OxyContin in the ways that they were, without any real science behind it. So I think it's important that Omari and I are very big on giving you the science behind these things, because at the federal level, it doesn't always happen that way. And that's one of the things that this series highlighted, in kind of some of the failures that happened to get OxyContin on the streets as it was anyway. But very timely, given that I think more people are wanting to have conversations about opioids again, now that we are kind of in this new normal with COVID and letting more things rise to the top.
Absolutely. As well as there have been some large national litigation cases against some big pharmaceutical companies that have paid out monies. Because I know I work in a couple, well, all counties in North Carolina actually are getting some portion of money from this opioid settlement that happened for the next 18 years. And I believe there's a next litigation that is happening right now to try to address the opioid crisis. I've actually done my MPH thesis capstone project, I remember what you call it, on this. And if you want to read, I will link it below if you want to read more on it. And it was specific to Marion County, Florida, but it gave a good overview of what happened in the opioid crisis and what has happened. Granted, it's like 3-4 years old now, but not much has changed
Yeah.
from that.
Yeah, things are staying the same. So